Good morning. Today we are going to see about the knee joint. Before starting the knee joint, we have to orient the leg. This is the lateral aspect of the leg, and this is the left leg, and this is the medial aspect of the leg. So before going into the topic proper, we have to know about some of the anterior compartment muscles. We already know some anterior compartment muscles. One is the sartorius, and then we have the quadriceps muscles. So the quadriceps muscles includes the rectus femoris and the vastus lateralis, vastus medialis and the vastus intermedius. So we are going to see one by one. So first superficial muscle, one is the sartorius is reflected here, and then we have reflected the rectus femoris muscle. So this is the rectus femoris, and then this will be the vastus lateralis. On the lateral aspect we have the vastus lateralis, and then medial aspect we have the vastus medialis. Now after reflecting the rectus femoris, we will be able to see the vastus intermedius muscle. All these four muscles, rectus and vastus muscles, have a common insertion. They are called as quadriceps tendon. So all these fibers are inserted into quadriceps tendon, and then this quadriceps tendon is actually inserted into the base of patella. So this patella is a sesamoid bone. So sesamoid bone, so this will be the superior surface of the patella, and this is the base of patella, and this is the apex of patella. So the quadriceps tendon is actually inserted into base of patella, and then it has an aponeurotic expansion over the superior surface of patella, and then from the apex of patella, we have the strongest ligament of knee joint, which is called as ligamentum patellae, or the patellar ligament, which will be inserted into the upper surface of the smooth surface of the tibial tuberosity. So ligamentum patellae extends from apex of patella to the upper smooth surface of tibial tuberosity. This is the strongest ligament of knee joint. And then laterally we have a thickest part of tensor fascia lata, which will be inserted into the lateral aspect of tibia. So we have the tibia here. So when we feel the tibial condyles, so this tensor fascia lata is actually inserted into the lateral aspect of tibia, and then medially we have the insertion of pes anserinus. What is pes anserinus? Pes anserinus is actually a common insertion of three muscles. One is the sartorius muscle belonging to the anterior compartment of thigh, and then second is the gracilis. Gracilis is the medial compartment or the adductor compartment muscle, and then the semitendinosus will be the posterior compartment muscles. So all these three muscles has a common insertion that is called as pes anserinus, which is inserted into the medial aspect of the tibia. So once we cut and reflect all these things, we will be able to see the knee joint structures, intra-articular structures. So we have to cut the quadriceps tendon here. Either the cut can be made on the quadriceps tendon, or it can be over the ligamentum patellae. So we have cut the quadriceps tendon along the base of patella. And then one more is the vastus lateralis. These four muscles, they have a common insertion over the quadriceps tendon. Separately, this vastus lateralis has an aponeurotic expansion over the lateral aspect of patella, that is called as lateral patellar retinaculum, which is going to be the lateral patellar retinaculum. Actually, we have cut here, but the lateral patellar retinaculum extends from vastus lateralis along the lateral aspect of patella, and it is inserted into the upper part of the lateral aspect of tibia. The same way, on the counterpart, we have the vastus medialis. This vastus medialis, it has an aponeurotic expansion that is going to form the medial patellar retinaculum extending over the medial aspect of patella, and it is inserted into the medial part of the upper part of tibia. So we have seen the ligamentum patellae, and then we have seen the lateral patellar retinaculum, and then medial patellar retinaculum. So we have cut the quadriceps tendon here, and then medial patellar retinaculum and lateral patellar retinaculum. Then we are reflecting the patella here. So once the patella is reflected, we are able to see the posterior surface of the patella. So what you are seeing here is the posterior surface of patella, and this is the femoral condyles. So this is the femoropatellar joint. So what we are seeing is the femoropatellar joint, and also we have the femorotibial joints. So this is the femorotibial joints. Once we flex the knee, we will be able to see the femorotibial part. So this is the femorotibial joint, and this is the femoropatellar joint, and this is the patellar surface of femur. So after reflecting this patella, actually So along the superior surface of patella, we have the suprapatellar bursa. The suprapatellar bursa is attached to the articularis genu. This articularis genu keeps the suprapatellar bursa in position. Okay, and then inferior to the patella, apex of patella, we have the infrapatellar pad of fat. It is the infrapatellar pad of fat, and then after removing all this infrapatellar pad of fat, we will be able to see the deep infrapatellar bursa. What we have seen here is the suprapatellar bursa. What we are seeing here is the first is the infrapatellar pad of fat and then the infrapatellar bursa. This is actually the deep bursa. Some of the other bursas related to patella are, one is the prepatellar bursa and then we have the subcutaneous infrapatellar bursa. What we have seen here after reflecting is the infrapatellar, deep infrapatellar. What we will be seeing here is the subcutaneous or superficial infrapatellar bursa. So we have seen 4 bursas. One is the suprapatellar bursa, deep infrapatellar bursa, and then prepatellar bursa, and then superficial or subcutaneous infrapatellar bursa. So to see the intra-articular surfaces of knee joint, we have to flex the knee. Actually, we have cut open the quadriceps tendon here. So the quadriceps tendon is cut here, lateral patellar retinaculum is cut here, medial patellar retinaculum is cut here. So after cutting and reflecting all these things, we will be able to flex the knee and then see the condyles of femur. This is the medial condyle of femur and this will be the lateral condyle of femur. Once after reflecting all these things, we will be able to see the fibrous capsule which will be attached to the bones, the condyles. Okay, the fibrous capsule will be there. After reflecting all this fibrous capsule, we will be able to see the intra-articular structures. What are the intra-articular structures you can see here? There is a C-shaped structure on the medial aspect that is called as medial meniscus, and then there is a C-shaped structure on the lateral aspect which is called the lateral meniscus. And then some of the other intra-articular structures are cruciate ligament. So one is the anterior cruciate ligament. What you are seeing here is the anterior cruciate ligament. After cutting and reflecting this one, we can able to see the posterior cruciate ligament. So now we have coming to the knee joint. What are the spotters kept here or the cruciate ligament? They can pin a structure here and then they can ask a spotter which will be the anterior cruciate ligament. They can actually keep a spotter here. Okay, this is the medial meniscus, this is the lateral meniscus. Sometimes they can ask the ligamentum patellae. It can be asked as a spotter and also the quadriceps tendon can be asked as a spotter. Very rarely, the tibial collateral ligament and the fibular collateral ligaments can be kept as a spotter. Usually, what is tibial collateral ligament? Laterally, we have the tensor fascia lata. After reflecting the cutting and opening the tensor fascia lata, deep to the tensor fascia lata, we have the tibial collateral ligament. This tibial collateral ligament actually extends from the middle aspect, and also the fibular collateral ligament extends from the lateral condyles of femur to the fibula. So laterally we have the fibular collateral ligament and medially we have the tibial collateral ligament. So to visualize the tibial collateral ligament, we have to reflect the pes anserinalis, and then deep to the pes anserinalis we have the anserine bursa, and then deep to the anserine bursa will be the tibial collateral ligament. What is the clinical importance of tibial collateral ligament? The clinical importance of tibial collateral ligament will be the tibial collateral ligament. Actually, it is attached to the both medial meniscus and also to the capsule. So in case of bucket handle tear or in case of medial meniscus tear, the tibial collateral ligament is also involved. And in case of unhappy triad of Odom, which involves 3 structures which can be easily remembered as ATM. One is the anterior cruciate ligament, medial meniscus injury, and the tibial collateral ligament. Anterior cruciate ligament, tibial collateral ligament, and the medial meniscus injury. All these 3 are called as unhappy triad of Odom. Thank you.